So for asthma therapy, we have the inhaled steroids are the common maintenance medication for patients with persistent asthma, but there are biologics that are now available and others that are coming onto the market for different populations of asthmatics. So depending on what type of asthma they have, or if they have what we call eosinophils, which are a certain blood cell that can be elevated with allergic diseases, if they have an antibody called IgE antibody involved with allergic diseases. So depending on their asthma phenotype, as we call it, or their type of asthma, there are newer agents available in the realm of biologics. There are different medications coming down the pipeline, one that was recently approved, but there is one that is being investigated at this time. It has been approved for atopic dermatitis, but not yet for asthma. And it looks very promising in the studies, so it's something that many of us, I think, are excited to see come to the market. As we go more into the future, trying to determine the phenotype or the type of asthma that someone may have is important, because then, as I said before, the biologics may be particular for different types of asthma, so we can streamline the therapy a little more or individualize the therapy a little more for patients. But I think it's also important from an allergic standpoint. With asthma, oftentimes allergies are involved, and so if we can identify the allergies, either eliminate or reduce exposure or treat those, then the asthma tends to do better for that reason as well. So for all those reasons, I think it's important to identify what type of asthma or what may be triggers of the asthma, so in order to individualize the therapy. We have a lot of good treatments for asthma. Unfortunately, I think asthma is still underdiagnosed and in many circumstances, for a lot of different reasons, undertreated. So unfortunately, there are still many deaths of asthma, many deaths in my city in Chicago. And this is something that is a worldwide problem and that we would really like to avoid and stop any deaths from asthma.